Will Medicare pay for gastric bypass, gastric sleeve, bariatric surgery? Yes and no. Stay tuned and I'll explain. Hi, I'm Sylvia with the Medicare Family. I'm the middle generation between my parents who started selling Medicare products in the 80s and my children that started selling them 5 years ago. So I would appreciate, and my whole family would appreciate, if you would hit the subscribe button and subscribe to our channel. We do one video every week on retirement issues, mostly Medicare, but also Social Security and other things that you need to know when you're getting ready for retirement. So I have a lot of people that ask me, hey, will Medicare pay for gastric bypass, gastric sleeve, bariatric surgery? And the answer is yes, if you have been under the care of a doctor and had some kind of diet plan for at least 12 months. And you have to have a BMI, your body mass index, of 35 or more. That's generally not a problem. And you have to have some kind of co-morbidity. And that's a term that unfortunately the whole world became familiar with due to COVID, which means some other problems, some other health issues. And typically for people that are obese, that are seeking these surgeries, they are diabetic. So that would make you qualify. So Medicare will pay for those surgeries. And depending on what type of insurance plan you have, you might have a little out of pocket, a lot of out of pocket, or no out of pocket. So if you are 64 and you're getting ready to go on to Medicare at 65 and you want to have one of these surgeries, you might want to opt for a Medicare supplement, even though it costs more upfront, because you're only out of pocket on a Medicare supplement plan G would be the deductible. So you'd have about a $200 total for the year deductible. That way, if you had the surgery, you wouldn't pay anything extra. If you get a Medicare Advantage and you want to have the surgery, then you are going to pay a per day hospitalization fee, which could be around $300 a day. And let's say you're going to be there for at least 3 days. Plus, you'll be seeing a lot of specialists, which would cost you around between $40, $50, $60 per copay. When I quote plans on Medicare Advantage, that's very, very much a broad stroke because it depends on what plan you're on, what state, all the way down to the county level in that plan year. But I threw out some ballpark prices to give you an idea. It's something to consider if you're looking at one of these surgeries, what plan you want to be on to have the lowest out-of-pocket outlay. If you have more questions about your Medicare, you can ask me in the comments below, or you can call us at the Medicare Family or email us at themedicarefamily.com.